Hi, I'm Andrea Truncali. I'm an addiction medicine specialist with a background in preventive and internal medicine. Today, I'll be talking to you about substance use disorders in physicians. After this session, you'll be able to recognize risks for developing a substance use disorder, have increased confidence when identifying a substance use problem in a colleague, and identify the medical professional health program as a resource. Substance use disorders, which I'll call SUDs to save us all a lot of syllables, can affect anyone. Physicians and other healthcare providers are no exception. Similar to the general population, prevalence has been cited as affecting 1 in 10 physicians, but some data suggest even higher rates in the range of 12 to 20%, with alcohol use disorders being the most common. Let's start with a word about prevention. While about half the risk of SUD is genetically determined, other key factors include the presence of co-occurring mental health disorders, history of trauma, and early onset of use. Finally, there's the impact of environment. So what does this mean for you? This means that you have some influence on the chance of developing an SUD. First, through awareness of your baseline risk. Is it average or above? Second, know that the prevalence of mental health conditions among physicians is rising. Preventing and addressing these may mitigate your risk for an SUD. Third relates to social norms and access. Subcultures where use of addictive substances is glamorized or normalized make it easier and acceptable not only to use substances, but to do so in an unhealthy way, i.e. in large quantities and or to cope with stress. The use of alcohol and increasingly cannabis is common in the US and tends to enjoy a tacit acceptance as a way of coping, as in evidenced in comments like, "Ugh, I need a drink after a day like today." If you're using alcohol or other substances to cope with day-to-day stress, you may not be developing skills needed to be resilient in the long term. Consider developing other strategies or pursuits for coping and finding relaxation and joy in life. And think about how your social environment is influencing you in this way. Even if you're using just for fun, you might take a moment to think about the associated risk of accidents and assaults in addition to that of an SUD. There are lots of tools online to help you think this through, including a CDC-based screener for high-risk alcohol use and a VA-based tool to evaluate the use of any substance called the Assist. Links to these are provided here and at the end of the video. Now, what if drugs or alcohol become a problem or an addiction, impairing your ability to perform your job consistently and safely? Unfortunately, addiction operates through denial, including self-deception. And it's often the case that others recognize it before you do, which means that you're more likely to recognize impairment in a colleague than in yourself. You can probably take a guess at what that would look like. Signs of addiction in others include missed work, frequent personal struggles, irritability and unprofessional behavior, change in appearance, social isolation, and or unusual behaviors like multiple prolonged shift breaks. When substance use becomes a problem, data show that medical errors are also more likely. And generally speaking, once work performance is affected, the problem is likely to be severe, as it's reached the point where the ability to keep it concealed has failed. Because of this, it is widely recognized that to keep patients safe and to keep our colleagues from doing things they really wouldn't want to do, we have to step in. As stated by 2 addiction specialists' commentary on the subject, the onus cannot fall only on impaired physicians to heal themselves. Physician colleagues and supervisors need to reach out to them. In fact, providers are legally mandated to report a colleague who we suspect has an SUD with the potential to impact care. Fortunately, in Maine, and in many, but not all states, there's a medical professional health program which provides evaluation, treatment recommendations, and monitoring. When a person is referred, the report is investigated, and if warranted, the person of concern enters the program. If participation goes well, this can obviate a board of licensure report entirely. In Maine, this body not only serves physicians, but also physicians' assistants, nurses, and nurse practitioners, as well as residents and students in these fields. And note, reports to the program can be made by anyone, a colleague, family member, or oneself. Deciding to report is rarely an easy task, but you might keep in mind that if you or a colleague is struggling with a problem now, it's generally better to get treatment early and potentially without licensing board involvement before the consequences and the suffering they cause accumulate. So what about medical professional health programs? Most people in these programs are mandated to them, and the treatment required is substantial. But much like programs for pilots, who also carry major responsibility for the safety of others, the outcomes of participation are good. Data suggests that approximately 3/4 of physicians who engage in the program are working at 5 years. The reasons for this are probably multifactorial, but having a clear structure, close monitoring with accountability, and a lot to lose are likely at play. This said, these programs have drawn criticism for their stringency, and the cost for monitoring and recommended treatments is borne by the patient. If you're interested in learning more about medical professional health programs, please see the references at the end of this video. We all have the potential to develop a substance use disorder, some of us more than others. You can think about your risk and what you might do to mitigate it, and get help if you think you need it. Finally, the medical professional health program is the place to go when you have a colleague with a problem that is likely putting patients at risk. Reporting by this mechanism can avert board of licensure involvement and is a way to help providers fulfill a sometimes difficult dual role in caring for our colleagues as well as the patients they serve. Thanks for listening, and take care.